Over the years, our relationship with food has drastically evolved. With just one click, fast food and takeout meals arrive at our doorstep, making convenience king, often at the expense of balanced and nutritious eating. But this shift has certainly encourages the unhealthy lifestyle and eating habits. The growing reliance on highly processed foods, the sugary snacks, and items which are high in saturated fats has had a profound impact on our overall health, contributing to the alarming rise in diabetes, hypertension, and cardiovascular diseases. In today's session, we will explore this critical and timely topic, which is the impact of diet on diabetes and hypertension. We are honored to welcome Professor Dr. Faraz Farishta, a leading diabetes specialist renowned for his deep expertise and patient centric approach. Dr. Farishta will offer his valuable insights into how dietary habits influence both diabetes and high blood pressure, the complex interplay between these conditions, and some practical strategies to manage them through informed food choices. Dr. Faraz Farishta currently serves as a professor at Medicity Institute of Medical Sciences and is a director of FS Endocrine and Diabetic Center, Hyderabad. With years of academics and clinical experience, Dr. Farishta is widely recognized for his contribution to the management of diabetes, thyroid disorders, and other metabolic diseases. His approach blends the latest in evidence based medicines with a strong commitment to the patient education and preventive care. So, in today's session, Dr. Farishta will guide us through the critical intersection of diet, diabetes, and hypertension, tapping how our everyday food choices can either fuel disease or foster health, and share some effective strategies to take control of overall well being. So, with this, Doctor, would you like to add something from your end before starting the conversation?
Yeah, thank you so much for inviting me. I think we are going through a very interesting time. We are now going through the AI world. I think this the
Yes,
more of westernization did good to our habits, but it did very bad to our, I would say, metabolism. So is going to do the AI. So again, I think artificial intelligence will make us more lazy. I think that is
yes,
what price we will pay as a society maybe in the coming years. So I think we'll further discuss on that. You can take it from here.
yes, definitely, Doctor. Thank you so much. So, we'll start with the conversation. My first question to you is: how does diet influence the development of diabetes and hypertension?
See, I would just continue what I was saying because, see, if you go back 4 or 5 decades before, so 40 or 50 years back, always India used to be known as a malnourished country. I think that if you
Yes,
see, at that time we were having more of communicable diseases. But as the westernization happened, and what I was saying about the more and more the lifestyle, the eating habits changed. So we forgot our basic roots. We forgot what nani ka khana, dadi ke haath ka khana. We stopped eating all that, and
yes,
we moved to the processed food. We moved to these fancy drinks, fancy food, where the diet is playing a major role. So now we are no more a malnourished country. We are a malnourished. That is the malls what you visit regularly for your shopping. So we are become a that country, and we used to have high protein diet. If you see, maybe 3 or 4 decades before, and now we have become more of a carb eating society. So
yes,
this is how diet is playing a major role. So there is a shift which is happening in the lifestyle, physical activity that has gone down. There is a drastic change which has happened in the dietary habits. You'll be surprised that if I tell you the incidence and prevalence of diabetes is almost equal now in rural and urban area. If you see that divide was very high maybe a decade before, but now because of urbanization in rural areas as well, the divide is not there. So the incidence of diabetes is as good as what it is in urban cities as well. So we are paying a price for change in our dietary and lifestyle habits.
definitely, doctor. So, with this, my next question is: To what extent do highly processed foods and the saturated fats and sugary items contribute to the unhealthy dietary patterns?
See, I think if I have to just label one thing which has done it all, it is the processed food. I think if carbonated drinks and processed foods would have been avoided way earlier, we would have not gone into this epidemic and now the pandemic of diabetes. There's humongous amount of patients which are there with diabetes in India, and you'll be surprised that the pre-diabetes patients are more. So this is like a tip of the iceberg. You're just seeing the patients who are diagnosed, but we are still missing the a lot of chunk which is there below that iceberg. So processed food, I think, is the culprit, and the aerated drinks are the culprit for not only increasing the risk of diabetes in adults, but we're seeing lot of these non-communicable diseases in children as well. So this is happening because again of these processed foods and the aerated drinks.
Yes. So, doctor, as we in nowadays we can see that everybody has their different diet plan. Sometimes people may skip their meals also. So, can skipping meals make these kind of conditions worse?
Definitely. I think feasting or fasting should always be avoided. Let me quote here that, of course, if you are doing fasting for religious reasons, that is completely different. We're not talking about that. We're talking about your fat diets where you are either doing a keto diet, you're doing a intermittent fasting. So there are
Yes.
so many diets plans which have come. But believe me, अगर आप मुझे पूछें 3 या 4 डेकेड पहले जो मैं आपको बता रहा था, there was hardly any diabetes or hypertension. Why? Because people used to walk, people used to have home foods, people used to have millets. Again, I think millets is one our own superfood which we have forgotten for ages. I think if you recall, probably आपके नानी या दादी का रागी की रोटी,
जी.
जवार, ये सब चीजें हम रेगुलरली खाते थे, सुनते थे एटलीस्ट. Now if you see, the younger generations hardly know anything about the ragi or the jawar or the bajra. That is because of these fad foods, the superfoods. India has its own superfood. I think millets are India's superfood, which doesn't tag you a price, and it has good fiber, rich in calcium, rich in iron. It has good protein. It is very good for your gut. It increases your gut microbiota. So definitely, I think it is time that we start replacing our foods with our old religious foods, what we used to have.
Yes, definitely, doctor. I must say it should be continue now also. Whatever we have eating from decades, whatever our grandparents or they are eating from decades. So with this, we are now have discussed about the some dietary plans and all. So I want to know that what preventive dietary strategies can individual adopt to reduce their risk of developing diabetes and hypertension also.
See, again, we as a practicing physician, we always say your plate should look colorful. So when we mean colorful, आपको so color नहीं करना है. When we say colorful, it is on the lighter side. It should have some green veggies. It should have some fruits. So if you divide your plate exactly into two, this one half you again divide it into two. So there are now three parts which are there. These predominant half part is where you need to take protein. So 50 to 60% of your diet should have proteins. So if you're a vegetarian, you can have all the dals. The dals have good protein. You have your paneer, which gives you a very good protein. If you are a little more sophisticated and you don't mind paying, then tofu is another good source of protein. When you come to non-veg, yes, you have most of these non-vegetarian foods which are high in protein. So I would say lean mass, avoid the red meat. So half of your plate should be with proteins. The other two halves, you can have, say, 25% should be your carbs, and then the rest 25% should be your greens, your fruits, your vegetables. So this is how you have to decide or divide your plate. And The best thing is you can have probably rice is another one thing which as a society we just cannot avoid leaving it. So a rice is where you can have it once daily in the probably lunch or dinner, and the other part you can replace it with millet. So replacement of two times consumption of rice with one time of millets would be a very good strategy, along with some good physical activity. So I'll just tell you, last week there was a study which was published in the New Journal of England of Medicine, NEGM, which says you have to do 7,000 steps. So there was a study which said that if you do 7,000 steps per day, it reduces your incidence of developing coronary artery disease by 40%. It reduces your chances of having mortality. It increases your lifespan, reduces your risk of developing cancer, improves your brain activity. It reduces your risk of developing dementias. So it is as important as food. So yes, take care of your food and then try to include at least 5 to 7,000 steps per day.
Okay. Thank you so much, doctor. I guess you have already answered my next question. What our audience wanted to know that from a nutrition standpoint, how does a balanced and healthy plate should look like? So, with this note, doctor, do you have any message or some tips for our audience on this particular conditions?
Yeah, so if first thing is if you have any NCDs, hypertension, diabetes, dyslipidemia, obesity, do not worry. I think first thing is do not go into that anxiety. Most of the time we see patients coming to us with NCDs that I have something which cannot be cured, it can only be controlled, and
Yes.
I'll have to take treatment lifelong. Believe me, if it's okay, don't over stress over it. Meet your physicians regularly and take their religious advice. Stick to your dietary pattern. Do some good physical activity so that you can at least prevent it from coming. And if you have it, you can prevent the complications which arises with these NCDs. So I would say be healthy, be fit, and then yes, millet would be our mantra.
Yes, definitely, doctor. Usually, this is a myth that we have to take the medications a lifelong time. The I guess the first thing should be you should accept the things that what are we having, and then try to implement some things to avoid some other complications in the lifelong period.
True,
Right.
very true.
Yes. So, with this note, as we wrap up the today's session, a heartfelt thank you to Professor Faraz Farishta for his time and for exploring such a crucial and prevalent topic. And also, Doctor, your insights into how your dietary choices have an impact on diabetes and also hypertension have been both informative and empowering. Also, to our audience, thank you for being with us. We hope this discussion has not only informed you but also motivated you to adopt some healthy dietary and lifestyle modifications or choices for your better health. And I guess it's important to understand that the small steps we take now can shape our healthier and fitter future. So we'll see you next time with the more expert conversations on staying healthy. Until then, take good care of your overall health and don't forget to follow us on social media handles for more such informative updates and wellness tips. So with this, Dr. Faraz Farishta, once again, thank you so much for joining
Thank
with
you. Thank
us.
you, everyone.